Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Hello and welcome back to Between Two White Coats. Thank you for joining us today. We are super excited because we have a guest with us. Amber and I like when we have friends. Yeah, so we
love to hear ourselves talk too. So there's that.
It
is fun when we get to add friends.
100% true. Yes. So we have Kristen with us today, and Kristen and I probably got to know each other a couple years ago, and she has a big presence in Instagram. Kristen, your Instagram page is?
Every Day is Darling.
Every Day is Darling. So I strongly encourage you, if you are listening to this on your phone, to just go right in and follow Kristen on Every Day is Darling, because she puts some fabulous stuff up. But Kristen has been a patient of ours. Our nurse practitioner, Scotty, shout out to Scotty, who refuses to ever come on the podcast.
But if you Google us, she shows up.
It is. Her picture shows up. So Scotty has been taking care of Kristen for quite a while, and Kristen was very brave and allowed herself to be vulnerable and sharing a lot of her own personal medical journey in her Instagram. And so I kind of followed along, and I was watching, and I thought, this is so amazing that you're willing to share this, because there's something that is very real, and I will be honest, it makes me mad, but I'm trying to get over that. I can share all the scientific evidence and all the research and say X% of people have this experience, and then there's one person's story. And one person's story will always make a bigger impact on humans than all the research and all the statistics. So we have invited you today to share your one person story about your weight loss journey, in hopes of being able to normalize what some people are feeling, in hopes of being able to have people be able to connect with your journey that you've been so fabulous with. So thank you for being here. Before we jump right into your story, what would you have us know about you?
Every day is not darling.
Amen, my
Every
sister.
Every day is not darling. We keep it very real around here, sharing more of the dirty side, the struggles, weight, motherhood issues. But I'm an open book. I love to share and talk to my audience about just real life struggles in motherhood.
You can totally call it
strugglehood.
That is the most perfect name ever.
This is a new phrase. Motherhood has become strugglehood.
Yes.
Amen. Amen.
Yes.
Yeah, we're in the middle of strugglehood ourselves, so we can relate. Yes.
And yeah, I'm a mom who some people, I think, see people online and they're like, oh, she's perfect. This is a perfect, life, a perfect story. And it is not. I have just as many struggles as the other mom. And I just love to share about my journey through wellness journey, motherhood journey, style journey, beauty journey. Like, I used to be a blonde. So, yeah.
So start us at the beginning with your when you first had concerns about your weight and what happened and led to that.
Okay, so I am a mom of 3. I gained 65 pounds with my first 2 babies. They're 27 months apart, so I didn't have too much time between them to lose the weight.
And when we talk about strugglehood, it's not like I had this baby, then I returned to my normal life where I just went to the gym 3 times a day. No, you have a baby at home.
Right.
It's not like even your hormones, it takes a year for hormones to attempt to even start to get back to pre-pregnancy.
Yes.
And you have this baby at home and you're not sleeping. And we talk a lot about the importance of quality and quantity of sleep. And so there's all this stuff.
And you're not making meals. Like you're grabbing goldfish because,
Yes.
there's snacks. So you're like, because you're busy.
Right.
And so you're like, I'll eat a cheese stick and yogurt or
And there
goldfish.
are 0 calories on what they left on their plate.
Yeah.
Like I found myself going, you didn't eat that nugget and you didn't eat those goldfish, so I'll just eat them.
I've got 3 plates. I'm just like,
yes. So I think that is a really common that our bodies do not return to what they were pre-pregnancy just because the baby came out. They just don't.
I was a young mom. I was 21 with my first, and I put on all this weight, and I had her, and I remember the first week being back home, I went to the bathroom, and I looked at myself, and I'm like, is that not gonna go back?
I did the same thing. So as a person with a lot of education, after I had my baby, I went home and went, I guess I only lost 8 pounds. The baby came out, he was 8 pounds, and then I lost 8 pounds, and that was all. Yes.
So, being a first-time mom, especially with my first, I was not concerned about myself. I was more concerned about keeping this baby alive. You want me to just go home with this and do? So I totally neglected myself. Still made time for myself to, go out and get my nails done because I needed the mental time. But as far as my weight and physically taking care of myself, that went out the window.
Yeah. And the get a massage or get your nails done is fabulous and it is self-care, but it's kind of the easier when you have no energy self-care.
Right.
The join the gym, get back to walking, things like that. Mm-hmm. You can't do that when you're not sleeping and that requires energy self-care.
No, that was the best I could do is get out of the house, and they need you to nurse or feed and you can't be gone for hours. So I have my 3 girls. My youngest is 3, and it was back in 2023, I believe, I started the shots.
Now, what led you to that? So, between, because you said you had 2 that are 27 months, and then the 3-year-old. So there's some time in between. Did you ever, from that second to third child, did you ever get back? And I put that in air quotes if you're listening on the podcast.
Right.
So I did. After my second, I had her in 2017. I got really I wanted to see change. But I basically starved myself. I was going to the gym and I just was not eating. Mm-hmm. And I was constly pissed.
Yeah, I was like, irritable. Yeah.
I was just
P.S. You're allowed to cuss on this podcast.
Okay.
If you need to, you just do what you got to do.
I was always mad because I was always just so hungry. So I think I lost back to my pre-pregnancy weight with my first. But it wasn't sustainable because I just wasn't eating and it wasn't healthy. It wasn't doing anything for, the inside of my health. So I eventually gained back, and then I got pregnant in 2020, the very end of 2020, or 2021, first of 2021, with my third, and only gained about 35 pounds with her, but still it was just extra weight. So 2023, it was Memorial Day weekend, and we went to the beach, and I remember having nothing to wear, and being a fashion influencer, clothing is my thing. Yeah. I share all kinds of clothing, but I couldn't find anything that I felt good in or that looked good, and it was at this moment that I was I cannot. And I was also, on this side of the screen telling people to love yourself and just accept who you are, and a little weight is okay. But I couldn't practice what I was preaching because it was just, I had to do something.
Yeah.
And to your point about you had to do something, but usually when I've had patients with weight loss, and I'm sure you've had this experience when we're talking to patients about weight loss, they can remember a specific time, a specific moment. I have patients that have brought like a picture as before and after because it was this picture that they took that they were like, oh my goodness. And then they were never taking pictures with their kids or they weren't enjoying their family. And I mean, I have one lady in particular who brought me a picture. The only thing she could find was an Easter egg hunt. Because it was a side view picture of her because she was like, I knew I was overweight. I wouldn't take pictures, and like a friend was trying to take a picture of her son,
accidentally in the
and she was accidentally in the picture, and so she was like, that was the picture that like triggered me to drop the weight. So you're saying like this Memorial Day, I was done. I was tapped out.
Done. We had gotten down to the beach late. We left after work on Friday. We had gotten there late at night, and me and my husband popped a bottle of champagne, and it was a side view. And my arms were up and, you know, my belly was out. And I was like, oh my gosh. I was going to post it on Instagram, actually, like a
every day is
boomerang
disaster for that. Right?
Yeah. And I'm like, oh my gosh, I cannot post this. Like, oh. So it was that weekend that I decided I've got to do something. So that was end of May, June 5th, I believe it was, 2023. I started the semaglutide. Now, let me go back. I went in to see Scotty probably 6 or 8 months prior to this, and told her, I was too scared to tell her I wanted to lose weight. So I told her I thought I might have ADHD. That's not a lie. I definitely have ADHD, but I might want to treat my ADHD because I knew a side effect of that medication could possibly help me eat less. And I don't think we ever, and I'm also scared to take medicine. I don't love taking medicines, and I question it, and like I said, bring Scotty in here. She'll be like,
I mean, you have some true medical anxiety.
Yes.
And so even coming to the doctor and talking about anything in a doctor's office is very anxiety provoking for you. And then you have to talk about something that is so difficult for people to say out loud. Right. And I so appreciate you saying that. And you had a relationship with Scotty. So this wasn't even like I showed up at this weight loss clinic where people are only there for weight loss and I met this new person. Right. You had a relationship with Scotty. You had a good history with her. Scotty, for those of you who know Scotty, she's super comfortable to talk about anything. Most people who see Scotty are like, Scotty's my friend.
She felt like my little mom, my little doctor, my medical mom.
Yes. And so but it doesn't really have anything to do with who's in the receiving end of it. Right. There's so much put on us about our weight, about our appearance, and then that we're not supposed to ask for help with that, or that if we were just strong enough, we would have done this. And in your past, you had starved yourself down to a good weight. So then there's that in your mind, well, I'm just not working hard enough. And then there is so much judgment around weight that before you even say anything, even to a medical professional, you're already going, oh, but what if there's judgment here? And so it is, and Amber and I recognize this in our many, many years of doing what we do. When people come in and talk to us about their weight, we are not their first stop. We are not their first thing they've tried. By the time that they're speaking to a doctor or nurse practitioner about it, they're frustrated. They failed at a number of things. And it's a very vulnerable moment. And it's not unusual that people have tears when they're saying, I'm so frustrated with my weight, or I don't know what else to do.
Often I'll try to break the ice because when we see it in our charts, like their body mass index will show up red because it's abnormal. And so I will often, especially for patients like that have seen me for years or whatever, I'll be like, hey, we're gaining 10 pounds. Like, what's so I try to, like, in a very nice, like, not for somebody new, but somebody that maybe, like with Scotty, you had seen her for a while, just to try to help the patients break the ice, because often patients are intimidated or scared to say something about weight. So sometimes I'll just break the ice for them as their person who loves and cares about them and knows that weight can be a big issue, both psychologically and physically. And so trying to help patients, bridge the anxiety thing.
Yeah.
So Scotty, she ended up saying, let's just try Mounjaro. There's this drug called Mounjaro. I think you would have success on it. And if you don't like it, we just come off of it. I think this would be a good option for you. So she wrote the prescription, and that was back when there was the $25 savings card for the real thing.
Yes.
I sat on that prescription for 6 months, would not fill it, just thought about it. Just thought, well, what if? Well, what if? What if? And
so what do you think is the biggest reason you didn't fill it?
The cancer side effect.
The concern with the concern with GLPs and medullary thyroid cancer.
Yes, because back to my medical anxiety, like I freak out about cancer. Like every headache is a brain tumor or something. Yeah. So I'm like, oh my gosh, why would I voluntarily take something that's gonna cause cancer? And interestingly, and this is sometimes where the conversations, even to be able to encourage people to follow back up with their provider and say, even sometimes I'll get a portal message that says, I'm too scared to start the Mounjaro. And I'm afraid I'm going to get cancer. And then we can come back to say, the odds of you carrying around 40 extra pounds, 50, 60 extra pounds is putting you at much higher risk of cancers, multiple cancers, than the risk of taking the GLPs. And so it's recognizing the risk benefit that's there so that we can help kind of keep people from getting too focused on all of like this medicine could be bad. And it's like, well, your current situation could be causing you harm as well. And so then you can go, okay, it's everything in life is a risk benefit analysis. Yes. And if you have 5 pounds to lose, why would you take the risk? If you have 60 pounds to lose, then there's a risk of carrying around 60 pounds.
But the caveat to the cancer thing is that I used to do oncology, and the type of cancer, I've had one patient in 20 years with that cancer.
Yes, and it's not
it's not
thyroid cancer as a whole. It's medullary thyroid cancer, which is a rare thyroid cancer.
I have one patient, and I currently
and if you have a history of that, you should not take these medicines. But otherwise, this is not something that worries the white coats
at all.
But it certainly, it worries patients. I know I'm putting something in my body. I know that something has side effects. I don't necessarily know, or I'm not focused on all the adverse effects of whatever the medical condition is. So it's easy to kind of get stuck there. So you were stuck there. You were willing to lie about wanting, not lie about having attention deficit, but lie about wanting medicines for it. Yes. Because you were thinking, I need medicine. I've tried other things. I need something to help kind of change what's going on in my body. But there was still that 6 months of discomfort.
Right. And Scotty did a great job at exactly what you just said. As a provider, I'm not concerned. She even told me, she said, just don't even read the black box label, Kristen. She's like, I know you, just don't read it. Just trust me.
Yes.
So I had hesitation. And then after the 6 or 8 months or whatever, after having it, and I was like, okay, I'm now going to do it. It was no longer
on the $25.
The savings card was gone. But that's about when y'all started offering the compounded semaglutide. So I was like, all right, well, this is the route I'm going to go now. So I tried it, and after the first week, I came in for my first week follow-up for my weigh-in and my check-in, and they're great about, keeping you on track, asking your questions about did you meet your goals this past week? Did you, get your water intake? Did you exercise? So that was a great accountability program too. But my first appointment back, she says she's at her computer and she's putting in my stats and everything, and I was kind of sitting behind her, and I could tell she was just kind of like, okay. And she goes, well, you've gained a pound. And I died. I was like, oh my gosh. So I got in my car after, and I did this whole Instagram story, and I was like, I quit. I gained a pound.
You've been on it 1 week.
I've been on it 1 week. So, and she was like, no, it's fine. You're probably not eating enough. These are just kinks that are going to work themselves out. So that was funny. Then the next week, it was I'd lost 8 or 9 pounds.
Yeah.
So.
And there's a couple of really important things that stand out to me. First, sometimes on the beginner dose, on all of these medicines, We start at low doses to get tolerance and kind of get used to and decrease that side effect profile, and then titrate up. And the research doesn't really support very much weight loss on the lowest dose of these medicines. It's really kind of as you increase to kind of the mid-range doses, I think, is where we see a lot of success. So many times when people are like, I've started, I'm so excited. And then it's like, but that low dose isn't going to be the biggest bang.
Yeah.
But then also many times people will kind of not lose. It's not like this. We all know weight loss is not this linear line that just, and I lose 2 pounds every single week.
Yeah.
And so if you have bloating or it takes a little time to kick in, and then the next week you're like, okay, here it is. Yes.
And I think I even had said I wanted to stay on the 1 milligram. So my third week or my third month. And, cause I was like, oh, I don't know if I can take any more than this. So yeah, I ended up losing, I lost on the 0.5 or 0.25. I lost on the 0.5, I lost on all of it after that first week. But starting to see the change and feel the change from within just made me so happy that I had made that decision to start, and actually regretted not starting it back 6 months ago, because it was such a positive change, and I wasn't starving. I was feeling satisfied and full, and still enjoying the things that I love, just much less. And it wasn't hard to stop after a couple bites.
Did you have, just asking, because obviously you didn't see me, you saw Scotty. Did you have like food noise? That's one of the number one things that I hear patients is like, yes, they love the weight loss, but like, I don't really have food noise. Like my husband always says all the time, like, could we just eat a full meal? Because I'll eat like an apple, a piece of turkey. Like, I literally have no food noise. It doesn't matter. I just don't want to feel hungry. Yeah. But for patients who struggle with food noise, where they are constantly thinking about food, they're done eating, they're thinking about their next meal. Like, that to me sounds exhausting.
Yeah.
Yes.
But, and I don't have that. So did you see that as a benefit?
Oh, absolutely. I come from a foodie family. Like my husband, we can't just have like a bowl of cereal for dinner. We got to have the 5-course meal, the appetizer, and he cooks it. So whatever.
Good.
So, I mean, that was part of my weight gain. He was just feeding me 5-course meals every night. But very into like the restaurant scene and the cooking restaurant type food at home. And my parents are big into like going out to eat. So I was raised just kind of always.
Well, it's the American way, right?
Right.
You have a birthday, let's go to dinner. You have an anniversary, we'll go to
And I will
dinner.
say there's 2 things for food noise. And food noise is really that thing in your head where you might not be hungry, but you're thinking about food, or you can't stop, or you're like, I'm not going to eat that. That makes me want to eat it even more. And you feel like you're in this constant mental struggle over food. And I will say, Amber, you probably have never had, you may just not be programmed like that, but also because you have celiac disease, and because we joke that really you're on a strict diet of lettuce.
Yeah.
You don't,
I literally lettuce.
You don't get the American
signals.
foods that create those signals. When they say can only eat 1 chip, it's because they put so many things into the chips that your brain gets the food noise. So our American diet has created food noise.
Yes.
And the GLPs help to balance what the unfortunate American diet is creating in a lot of us. If you eat those processed foods or other things, the food noise will get louder and louder. And then sometimes when you've come off of those, you can decrease the food noise some, but the medication really helps work on your brain to allow you kind of freedom from that, or to allow you to step away from it. This is delicious. I'll have 5-6 bites and I'm good. I'm full. I don't have to, I always say 1 slice of pizza tastes the same as the entire pizza.
Right.
But what is it that makes you not be able to say, I've had a slice, I feel good, and I can stop?
And I think that's one of the biggest things for me that the medication did was remove that food noise.
Yeah, so that you could enjoy food, but then you could go, and I've enjoyed it, and I'm done. Mm-hmm. Yeah, which is huge.
And I'll eat. I love healthy foods. I love. It's not like I was eating straight junk, but it's the quantity. Like, I would eat a ton of whatever the healthy food was.
And so in your journey, you've lost how much weight?
I lost Almost 70 pounds.
Wow.
Which was not my intent to start with. And, they ask about what's your goal weight? I wasn't really, I didn't know what my goal weight was. I knew, I think
No
I
one does.
didn't want to look like I did in the picture.
Yeah.
I'll tell you that much.
That's exactly
not
right.
this. But I lost, or I wanted to get down to about 150. Then I got down to 150. I was at like 195, I think, when I started. I remember getting on the body comp scale in the clinic, and I was like, oh my God, this is horrible. And so then when I got down to my goal weight, I was like, that's hitting my goal weight. I want to keep going. Because I've never been this size as an adult. So I'm at like 135 now, 130, and I like being right here because I can gain a few, lose a few. But yeah.
How tall are you?
I'm 5'6.5".
Okay. So you're still within a normal BMI, which you said, what did you weigh like prior to your first pregnancy?
I was like 160, 165.
So like you said, truly like the smallest.
But, when you have babies,
Yeah.
your weight.
Oh, and it shifts.
It shifts.
Yeah. No,
And
I was just curious
that
to see.
160 was not this 160.
Because you don't, like, and I mean this, patients will know, if they start losing too much weight, I'm like, you look sick.
Right.
Stop. But you do not.
Right. Yeah. And I think I'm at a good weight right now.
Great.
But then you have the people that are like, you do look sick. You need to gain weight.
Which makes me whenever we have a guest, Amber and I like to talk.
We just never shut up.
We cannot get enough of Kristen. So I want to dig more into how did you know where your goal weight is? How do we help people know where their goal weight is? And then what does maintenance of that goal weight look like? Because we all want to act like we crossed a finish line and we and we can stop running the race. And that's not how health goes, and that's not how weight goes.
No. It's like a marathon, like your provider runs, like Scotty. It's
so stick with us for the next episode where we talk to Kristen about maintenance and about how did we know when we were done losing, but then how do we maintain and not gain back, because too many people are on this roller coaster. Yes. And we also, I want to dig into some of what the people say. Because
they have a lot to
the
say.
people have a lot to say, and you are out there as an influencer in social media where people say things that they wouldn't say to your face. So we're going to dig into both of those things.
All the trolls.
So stick with
us.
us.
We probably are told and we don't care and don't know.
Oh,
But yeah.
wait. I don't know that I'm interesting enough to be
I
trolled.
know, right?
Kristen is, but I'm not.
Yeah, we're not.
So stick with us on some more episodes with Kristen where we dig into these other topics. We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is nature. Just being outside, hearing the birds, seeing the sky, seeing the grass, the colors are calming. God has done amazing things in this world, and nature reminds us of that. Thank you for joining us today, and until next time, take care of yourself.